Welcome back to McLaren Port Huron's Today's Health, and we're talking about mitral valve repair in this segment with Dr. James Martin. Dr. Martin, can you walk us through that mitral valve repair?
So, mitral valve repair is an open heart surgery. It is mostly done through an incision in the front of the chest. It does involve putting the patient on a heart-lung machine and stopping their heart for a brief period of time while we go inside the heart to fix the valve that lives inside the heart. There are a large number of different techniques that we can use to repair mitral valves depending on exactly what's wrong with the valve. Most mitral valve repairs involve what's called an annuloplasty, where we stabilize the opening between the two chambers that the valve lives in with a ring. A ring is just a circle of cloth that we sew into that opening to make sure that when we're done with our repair, that will not change in size, which can cause recurrence of the regurgitation. So mitral valve repair has been shown to be a very, very durable, long-lasting operation for the vast majority of patients that is far superior in the majority of instances to replacing the mitral valve. In addition to annuloplasty, sometimes we'll remove some excess tissue, sometimes we'll augment some missing tissue, such as after an infection destroys a part of the valve by adding a patch of material to the valve. And sometimes we have to create artificial chordae. The chordae are the little strings that tether the leaflets and hold them in place. And if the chordae are torn or elongated, we may need to make artificial ones. There are more techniques than those, but those are the most common things we do to repair a mitral valve.
How soon do you know if the surgery was successful, and what does recovery look like?
So in the operating room, with the patient asleep, we have a TEE probe in place. A TEE probe is a echocardiogram that's placed inside the patient. So once we're done our repair and the heart starts beating again, we look very carefully at the mitral valve and make sure that it is perfect before we close the chest and leave the operating room. And that is our quality control, if you will, to make sure that we have done the right operation. If there's something minorly wrong, we frequently can go back and fix it. And if something is clearly majorly structurally wrong, occasionally we might have to replace that valve that we thought we could repair. That's unusual. So most patients will be in the hospital 4 or 5 days after the surgery and then go home. Most patients feel much better than they did before the surgery by 6 weeks after the surgery. And it's a 3 to 6 month recovery until they're as well as they're going to be. But I always figure if you're better than you were when you started at 6 weeks and it takes you 6 months to get all the way well, that's what I call gravy.
Absolutely. Well, now everyone wants to make sure that they're getting the best heart care because it is your heart. So can you tell me a little bit about McLaren Port Huron's heart program?
Yes, well, we have a newly revamped heart program here at McLaren that we've been administering now for 2 years, and we've grown the heart program by over 100% since we started here, and we've also significantly grown the valve program here since that time. We're doing excellent work on both the aortic and mitral valve, as well as the tricuspid valve as well occasionally. And we have no hesitation of doing any of these type of operations safely and successfully here in McLaren.
Do you have any closing comments for our viewers?
If you are not feeling well, for whatever reason, you shouldn't put it off or ignore it. You shouldn't downplay it. A lot of people say, oh, I just thought I was getting older, or I I didn't really pay that much attention to the fact that I was so much more tired than I was previously, or the shortness of breath. I really didn't pay much attention to it. I just stopped doing some of the things I was doing before. If you can't do the things that you did a year ago, that's not getting older. You know, and so you should see your doctor.
Thank you so much for this great information.
You're welcome.
Thank you for joining us. If you have any questions about anything we've talked about today, which is a lot and really amazing, call us at Health Access. That's 1-800-228-1484. Or you can always go on our website, and that's mclaren.org/PH contact. You know, you can order a copy of this program, and that's mclaren.org/PHTH. Join us again next week for Today's Health. Today's Health is brought to you by McLaren Port Huron. McLaren Port Huron, doing what's best.